Let's begin the topic of ENT surgery, and in the first section of our lecture we will talk about the technique or procedure known as cryosurgery. We will discuss the mechanism of cryosurgery, the technique and use of cryosurgery technique or method, and the advantages and disadvantages of cryosurgery. Cryosurgery is the technique in which there is rapid freezing. Cryo is the cold, so the surgery or the procedure performed by the use of the freezing temperature, cold temperature, is known as the cryosurgery. Rapid freezing of tissues to temperature of minus 30 degrees Celsius. Very, very low temperatures are used and below, and their slow thawing causes destruction. So slow application of freezing temperature as low as minus 30 degrees Celsius, and this freezing temperature cause destruction of the tissues and cause damage to the tissues which are needed to be destroyed or removed. This is the effect of the temperature. The pressure and temperature is changed to P2 and T2, and this is known as Joule-Thomson effect. So the use of extreme freezing temperature. Open method, and we have a closed system cryoprobe method. So it can be open method of cryosurgery or the closed method of cryosurgery. The mechanism of cryosurgery, or the mechanism of tissue destruction, how the tissues are destroyed by the freezing temperatures. It can cause dehydration of the tissues. The dehydration of the tissues can cause destruction. So dehydration, denaturation of the tissues, thermal shock, vascular stasis, cryoimmunization. This is the picture which is before the surgery, before the cryosurgery procedure is applied. 15 minutes after the surgery, and then this is 7 days after the surgery. So in this procedure, the tissues are destroyed, and the mechanism by which the tissues are destroyed, it can cause dehydration of the tissues, denaturization, thermal shock, stasis of the blood vessel, the blood supply is decreased, the vascular stasis occur that can cause necrosis and death of the tissue, and it can cause cryoimmunization. So you can see the extra tissues which are present that are removed by using the freezing temperature, and that's the picture 7 days after the procedure. The technique of cryosurgery, local or light general anesthesia, sometimes no anesthesia is used. So it can be local or light general anesthesia, or maybe no anesthesia is used, depending on the procedure or the area that is being surgeried. Area to be frozen is insulated. Cryoprobe applied. Later frozen quickly for 3 to 8 minutes. Allowed to thaw slowly. and repeated once or twice. So area that needs to be this area in which the tissues needs to be destroyed, in which cryosurgery needs to be performed, that is isolated. Then the cryo probe, very cold freezing temperature, is applied to the area for about 3 to 8 minutes, and then this procedure can be repeated once or twice, and this can tell us that how the very freezing cold temperatures can cause damage to the body, because it causes destruction to the tissue and the death of the tissue. So that's how the procedure is performed. Maybe some mostly local anesthesia. If general anesthesia, it's very light general anesthesia that can be used. The area frozen should include a margin of normal tissue. So always include a portion of normal tissue in the area that needs to be frozen. Thermocouple implanted to ensure freezing at an adequate depth. After cryotherapy, area allowed to heal by secondary intention. So healing is by secondary intention. It is healed by it's on its own by the normal natural mechanism. Necrotic slough falls off in 3 to 6 weeks. Repeat cycles of cryotherapy if required. Now, what are some uses of cryotherapy or cold surgery? Uses are, it's used in benign vascular tumors like hemangiomas involving skin and oral cavity, angiofibromas, glomus tumor. Then it is also used in premalignant lesions like leukoplakia, solar keratosis, in malignant lesions like Bowen disease, basal cell carcinoma, advanced cancers, recurrent or residual tumors. Other uses are nasal turbinates to reduce the size, allergic rhinitis, cryodestruction of tonsils. These are some very common uses of the cryosurgery. We can use it in premalignant lesions, malignant lesions, and different vascular tumors like hemangiomas, angiofibromas, glomus tumor. In all these conditions, we can use the cryosurgery. Now, the advantages and disadvantages of the use of cryosurgery. Some advantages are useful in poor risk patients and can be applied without anesthesia or under local anesthesia. In a lot of cases, usually the anesthesia is not safe to use in those poor risk patients. Usually the advantage of this procedure is we can even perform it under local anesthesia without any general anesthesia. It's also useful in patients with bleeding disorders or coagulopathy. Can be used in multiple cancers, palliation of recurrent cancers where second course of radiation is not advisable. Causes minimal post-treatment discomfort or pain. Cause minimal scarring, can be used at site notorious for keloid formation, for example, pre-sternal region. And it is an outpatient procedure. So all these are the advantages of the cryosurgery. Some disadvantages: no tissue is available for biopsy in case of small lesions. Not possible to assess margins of tumor to know whether free of malignant cells. no control on depth of freezing. When used for skin lesions, cryotherapy causes depigmentation and loss of hair due to destruction of hair follicles. Anesthesia of part is required when lesion is near the nerve, for example, ulnar or digital. So all these are the advantages and disadvantages of the cryosurgery for the treatment of different lesions, which might be malignant, pre-malignant lesions, vascular tumors. So we can use the cryosurgery. We have some advantages and also we have some disadvantages. So that concludes our topic of cryosurgery. Thank you for watching sqadia.com.